Good afternoon. Is this on? Can you hear? Good afternoon. Do you need this? We're on. Okay. Thank you very much for attending today. I'm Ron Adkins. I'm the Executive Director of the Gallia-Jackson-Meigs Board of Alcohol, Drug Addiction, and Mental Health Services. 2 years ago, the Coalition for Healthy Communities stood together in support of efforts to ensure that low-income Ohioans living with mental illness or addiction disorders had access to Medicaid. After witnessing the impact that Medicaid has had on so many lives, the Coalition today is renewing its plea to lawmakers to continue this expansion. If you've been following some of the other press, one of the headlines this week, Ohio House Speaker Cliff Rosenberger says he won't press to repeal Medicaid expansion. So we are very happy with that news. I can tell you from my board area, since the inception of Medicaid expansion, we've been able to serve 539 additional citizens in our communities, services valued at a little over $1 million additional dollars. And for my area, that's been a really big deal. Another impact of Medicaid expansion, my system has added approximately 42 new jobs in our system of care, and so that was certainly appreciated in our high unemployment area. I can tell you for a fact that the increased health care coverage due to Medicaid expansion has made a big difference for the individuals who now have health insurance, and it would be devastating if they lost it. Today we're going to hear from several speakers. I'll introduce them in the order they'll be speaking. Ben Ertel, Pam Harris, and Cindy Koumoutzis are three individuals and or family members who have positively been impacted from increased health care coverage through this expansion. We also have Hancock County Sheriff Mike Heldman, Bobbi Douglas, the Executive Director of Liberty Center Connection, and Alicia Bruce, the Mercer County Common Pleas Drug Court Coordinator. Again, I thank you for all joining us today. I want to express my appreciation to the presenters. For the media, after we're over, we'll open it up to questions. So our first speaker, Bob Ertel.
Hi everyone, my name is Ben Ertel. And I used to be an opponent to Medicaid expansion. The health care bill that we all know as Obamacare, used to be an opponent. I was an employee at the University of Cincinnati Medical Center for 2 years, up until this last June, when the antidepressant that I was taking at some point stopped working. Instead of seeking help, I quit my job and went into a major depression. Luckily, my family had intervened, and I was able to fully recover. I was covered with the insurance through my job until the end of the month of June. And then I was appalled to find out that COBRA, which was my option at the time, would be about $400 a month. I went into inpatient hospitalization for 5 days. I was placed on new medications. I was recommended and sought outpatient treatment and to see a psychologist. And so I had to continue to keep my medical insurance, and with that being COBRA. Luckily, as I applied for insurance in the marketplace, I found out that I was eligible for Medicaid. I went from paying just over about $1,000 a month for medical bills and medications to maybe around $250 a month. The best part is that with the stress of keeping up with bills gone, I was able to take a course and obtain my state tested nurse's aide license. I found a full-time job within a month of receiving my license. And so from leaving my job in June to getting approved for Medicaid on the 1st of September, I became insured through my employer on December 1st. Medicaid was there for me when I needed it most. Without it, I'd either be in enormous debt right now, or maybe I would have stopped seeking the care that I needed because I just couldn't afford it. With that being, I don't know where I would be today. I can't imagine what a less fortunate individual would have gone through, someone who had not maintained full-time employment, who didn't have family to look after them, someone without the care and support that I received. Without Medicaid, they possibly never could get to the point that I got to, possibly never recover from depression, and I know firsthand what that could lead to, if not death and serious consequences. So, appreciate you all being here today. Thank you for your time.